So again, another formal welcome after the recording starts so that people doesn't know that I'm starting without even introducing myself as well. This is Ihab Dimian. I'm the founder of 𝒐𝒊𝒆 and the board director. I'm working with 𝒐𝒊𝒆. I founded it actually since 2016, and I've been working with it since that time, and with the team that I'm so proud of. We started with OSCE, and then now we expanded to the MCQ and evaluating. We're covering the full range, as I mentioned before, with the healthcare professional. Just going back to the slide to show it, it's not only a pharmacy-focused company, it is covering the whole healthcare range, including medical doctor, nurses, dentists, and vet to join soon. We were talking about the success formula, and we cannot do it ourselves. We can assure you that our Q&A bank, our cases are all top-notch. We do not copy from any existing materials. We use our own invention based on previous experiences for sure, but we can assure you that what you see with us is different than what you see in the market, or you can even bring for no money. Second, what we can assure you with is the team. The team that we have are all licensed pharmacists, people who already run the same exams, people who went through the same process, people who went through the same pain, because I cannot get, with full respect, a pharmacist from wherever in the world and just let her or him conduct courses that they did not get examined on. So it will be unfair for you. So all our instructors are licensed here in Canada. But we cannot do it on ourselves. We have to have the third dimension, which I consider as important, if not more, is you. We need passionate, motivated, and fighters, candidates. We need people who are really passionate to succeed. Okay? Remember that, because some people think that courses will make you succeed. No. Our courses, or any course in the market, would help you to succeed, but you should help yourself as well and help us to achieve this objective, success with confidence. Two things I want to start with. OSCE is different than MCQ and evaluating. The exam is different, the format is different, even the way that you study in it is different. So that's why I always remind my OSCE students, outcome is not enough to pass OSCE. Outcome is what you say. Outcome is the A, B, C, or D multiple choice that you will choose in the evaluating or in the MCQ exam. It's important for sure. You have to say the right answer, but the right way. It's not only about the right answer, but how to deliver it. It's not only what to say, but how to say it. That's why we put big weight on the communication and overall performance. And that's why I'm just giving you a sample of a result report card. I hope none of you receive this, because the only people who receive the report cards are people who did not pass. But I'm just giving you just a sample showing that if you see here on the outcome side, it's not the only reason for failure. You can see that the bars of the communication and the bars of the overall for performance were not achieved. So hence, the core competencies required were not achieved. Our role in 𝒐𝒊𝒆 is not only to teach you what to say. We're going to teach you what to say or what to select in the MCQ and evaluating, which is the A, B, C, or D. Multiple choice, you choose the right thing, the thought process until you reach it. But how to deliver, how to communicate, this is what you're going to learn with us. And this is as important as the outcome in the OSCE exam. 9 stations. The OSCE exam are 9 stations. Interactive and 2 non-interactive. So in total, they are 11 stations. There is no pre-test anymore, okay? It's done. So every case is counted. Every station is counted. So we do not say, you know what, let us focus only on the big topics, like sometimes we do, which I'm totally against. And 𝒂𝒂 will explain that later on in the MCQ. For sure, we have weights. We are not studying the CNS in the same way like we are studying the eye condition, but we cannot ignore topics. You cannot just go to the OSCE exam saying, you know what? I'm not going to bother about the ear condition and the mouth condition. These are very little. What if you got a station? It's as much weighted as the depression station. You cannot do this strategy, and I do not accept it. And even during our course, you will find that I'm covering almost as much as the time allows, all the therapeutic areas, all the minor elements areas, as much as I can, and then I give you assignment to cover the rest. 7 minutes is the total, is the total time of a station. But for EDGE student, just remember, we have 9 minutes, and we will explain why. Not because we are the label EDGE, but you will do things to make you have this extra 2 minutes. And you will be so happy when you do it, hopefully in the exam. We have one alarm to start, and you will hear that when we start our role play, and then another buzzer to tell you that there are 2 minutes, and then a final buzzer, which is the 7-minute buzzer, which means end of the station, and you have to leave immediately. You cannot say anything after the final buzzer. And then you have a rest station with 2 minutes in between. So what about these 9 stations, the interactive? As we said, we have 9 interactive, 2 non-interactive. What is the format? What is the split of these 9 stations? 40 to 50% of these 9 stations are built on prescription filling and plain counseling. And we will discuss this during the courses, because this is about half of the exam. Prescription filling, counseling, plus or without, with or without drug therapy problems. Big bulk. And yes, there could be like 4 stations out of the 9, 4 to 5 stations, you can get it based on this prescription filling, with or without DTP. 20 to 30% of the exam is OTC related. This is where over the counter, no prescription, and it has education component in it. Somebody coming to get your opinion and your recommendation for some bothering symptoms about constipation. And then you start interviewing the patient and making sure there is no red flag, and then you recommend something, and then you do the monitoring plan. Very important. You cannot ignore the minor element. And then 20 to 30% of the exam is healthcare professional based, meaning doctor case, nurse case, physiotherapist, you can name them. We cover all that during our program. Non-interactive, we have a very smart simulator, exam simulator, self-study, that I recommend even for the people who are starting with us, to start the self-study of the EDGE Max before starting the program, because it's a online exam simulator. It has the instruction very clearly outlined. You do the station, and then you get the answer. So it's very interactive, and it will make you on top of things regarding the 2 stations related to the non-interactive part of the exam. So remember that we cannot ignore the non-interactive. We cannot make it without the non-interactive. Okay, 7 minutes, and we have 3 blocks. 7 minutes and 3 blocks. The block 1 is info gathering. First part or first section is info gathering, and this is the introduction, breaking the ice, patient information update, medical history, prescription, and OTC history assessment, plus spotting any issue. And when we do the role play, I want you to pay attention very, very much to this first part of the station, which we call the info gathering. But be careful, we cannot take 5 minutes out of the 7 minutes interviewing the patient and asking questions. We have time limit for each section. If you exceed it, you will never finish on time. The 7 minute will not be on time. So 2 minutes is your max. 2 minutes is your cap for the info gathering. In the beginning, forget it, and don't worry. You will never be able to finish the scheme, the OSCE scheme, the questions you have to ask in 2 minutes. But by practice on your own and practice with us, you will be able to make it even below the 2 minute mark in some cases. What is the second section? Reference checking. Reference checking could be reference books. And by the way, everything now is printed. You don't have, they will not get you the book, they will not give you the therapeutic choice to open it. In my time, like 2013 time, sometimes they were putting us the full book, the whole book, and I have to open. So it takes like another half a minute to open the chapter. Thank God it's not anymore. You just get the printout of the reference you need to check and you do it. But be careful, it's challenging. It's easier said than done. So you need to, and I will get to this reference checking because it really affected the success of many people because they do not read English quick enough. They struggle in reading. So that's why they never finish that station on time. We will discuss that when it comes to that. And then the information provision, the counseling. And counseling, remember, could be with or without DTP spotting. And then finally, the follow-up and monitoring plan. This is the 7-minute structure. And by the way, when we do our program, every station is timed. We don't do like unlimited time. From day one, and even today, when we do a role play, I will have a role play, it's timed so that you can visualize how the exam would be. Okay. Remember when I said we have 2 extra minutes? Yes, EDGE people, do not waste the 2 minutes to read the door sign. We have 7 minutes inside the station and 2 minutes before entering the station. Do not waste them, guys. Do not waste them. They give you 2 minutes to read the instruction. You see this, what I'm circling in red? This tells you what is the instruction, what is your role in this station. You are meeting with a doctor and he requires a recommendation, or you are getting to a patient in OTC. They give you the outline of the station. And guess what? Sometimes it has keywords. And during our program, we will learn what keywords mean. And this can accelerate, this can speed up our info gathering and our time management process. So do not just wait in front of the door, not staring in the ceiling until the buzzer comes in. No, you start, your mind will start, and we will discuss during the program what are the actions you need to do in the 2 minutes. You can see that there is, even in the picture, it shows that one of the students is reading so carefully, and one of the students is, I think she is playing in her hair or doing something different than OSCE. So one of them is really determined. And one of them here on the left, she's not even looking at the door. No, she's looking to the right to her. I don't know what she was doing. She was looking to the right, maybe looking at her friend or what. This is real exam, guys. So we will discuss what you need to do during this 2 minutes to be fully ready and prepared. The info gathering, remember, we have 2 minutes and we have to cover 4 main bulks: allergy status, medical conditions and RX medications, OTC vitamins and herbals. And you will see in the role play how we do ask the questions in an efficient way. And by the way, the more you practice, that's why in our we have an assignment every week to practice between 15 to 20 hours on top of my class. You cannot rely only in 7 hours, only a week. I'm talking here about OSCE. I'm going to see you once a week for 7 hours. It's not enough. I'm giving you the guidelines and the strategies that you have to apply throughout the week. So be very careful that practice makes perfection. Do not let this go out of your head. We will learn the techniques of linking the medical condition to the RX medication. We will learn the technique to ask relevant questions only, even in the lifestyle, what we call the case D, the coffee, alcohol, smoking, exercise. We're going to learn together the diet. We're going to learn together the techniques and strategies that fit to every station. That's why, guys, it's not about some papers you're going to read and you say, I will just read this paper and go to the exam. It requires a lot of practice to master the skills. And it's difficult to be done by yourself. I'm not saying it's impossible, but you need to get guidance and then practice on your own. Get guidance and then practice, not on your own, sorry, practice in a study group. And that's why we have study groups that you will be enrolled in on your own with your friends, 4 people, 5 people, and you practice with them based on the coaching you will get in the class. Info gathering, 2 minutes. We can stay. I will tell you in the beginning and in the first class, even if you go back to the history, you'll find in the first class some people take 4.5 minutes. 4.5 minutes in only in the info gathering section. Can you imagine? We have only 7 minutes, so definitely they will never finish on time. Is the info gathering in the prescription filling different than the OTC station than the doctor station? Yes, there are little differences. And this is what we're also going to learn during the program. In the OTC, you are acting as a doctor. You know that? A patient is coming for your recommendation for some bothering symptoms that he doesn't know what is it. Sometimes they tell you, I have set of symptoms. What are they? I'm having runny nose. I'm having teary eyes. I'm sneezing a lot. And that's it. Any other symptoms? No. Do you have fever? No. Do you have any problem with swallowing? No. Do you have pain in the ears? No. We ask these questions, we have to be mastering it so that you can tell the patient that your symptoms overlaps mainly with allergic rhinitis. So you act here as a doctor. He will not come to you to tell you, I have allergic rhinitis. Can you make me a recommendation, please? No. He will ask you to define what is this condition belongs to, or what is the definition? Where are we standing? Are we in a flu case or a common cold case or an allergic rhinitis case or even a COVID case? So we're going to learn together how can we get to this and you see the last point, red flags, because the red flags can bring you somewhere else. If there is one red flag meaning dangerous symptom, something that you cannot deal within your scope of practice as a pharmacist with it. So if with all the symptoms I mentioned, like to you now, I just added, and I have fever 41 degrees Celsius. I have fever and the reading is 41. How long it has been like that? For more than 2 days. I'm giving any example, okay? Here, it's starting to get into the category of red flag. I cannot deal with this on my own. Here, it's a referral case. Is it common? No, for sure. The majority of cases, you're going to deal with the patient until you recommend something. But if I don't know the red flags in every single OTC station, I might be potentially harming the patient because I will give him or her something that can mask the symptom, and later on, it might worsen the condition. So we will learn all that also, but just giving some glimpses. I hope it's making sense to you. Info gathering in the OTC still having the same layout. I'm not saying it's totally different than the prescription filling, but remember that it has one extra thing, the assessment. That's why I called it the SAT method. The SAT method, just to, I always like to work with acronyms so that, if you can remember it even during the exam. We will talk about the self, age, time, medication, what you have tried before, the history, if there is any other symptoms with the most bothering symptoms, and what are the danger symptoms, what we call the red flag. So it has more components. You see, in the OTC, we do more analysis, more in-depth assessment until we reach to the, what is this condition? And is it self-treated? I can deal with it in the pharmacy, or I need to refer to a healthcare professional. Reference checking is the second section. Remember, we have 3 sections. The second section of it is reference checking. And reference checking, remember, 2 minutes max. And I know that some cases it requires more than that. So I would say 2 to 2.5 minutes. But I want to remind you, before even you start your OSCE studies, and you can ask any of your colleagues who passed this exam. Some people do not make the OSCE because they are slow readers. They do not read English in a proper pace. And by the way, I was one of them. All the international pharmacy graduates, they have this issue. Why? Not because we are bad, not because there's something wrong with us. The problem is we do not have the same mastering. I mean, the same techniques that we use during our pharmacy school. Remember, during pharmacy school, it's not like in Canada or in the US. They have in the US and Canada this kind of OSCE, mini OSCE stations for pharmacy students. But remember, back home, whether you are from Egypt like me, or from Algeria, from Ghana, Cameroon, any country in the world, our pharmacy school was mainly based on memorization, concepts, retrieving concepts. We have to know the structure of the molecule. We have to know the side chains. We have to be very good with the side effect, memorizing the side effects of the classes of medications. It's totally different. Yes, we have an oral exam, but it was also memorization. I went to an exam. I was staying in front of a doctor who was examining me, and he was opening the book and asking me, tell me the definition of XYZ. Okay, so what's the difference between I say it and then I write it? It doesn't make any difference. So we are not used to the OSCE setup. So that's why the OSCE setup requires an open book setup. You have the reference in front of you, and you have the answer in the reference. But if I am a slow reader, if I'm not used to skim professionally, I'm done. And this is an English skill, not an OSCE skill. That's why, please, guys, if you are having issue in your IELTS or OET, these are two exams you need to do. I hope you know them. English exams you need to finish in order to get your license. So I always ask the OSCE students to study for the IELTS or OET during studying for the OSCE, because it will help each other. They will synergize each other. So I'm just trying to highlight here that we need to be very quick, very efficient in skimming and finding the answer, and then delivering it. The last section is providing the information. Providing the information. And providing the information is the counseling. And we are very, very, very picky with this, guys. We are so picky with counseling to be on top of it. 8 points that you need to tick the box on it. I cannot say the name of the medication without saying the generic and the brand. I cannot just go and say what does it do without telling the strength. I cannot just give one indication without mentioning 3 side effects. I cannot just do the counseling without giving at least one precaution. You see, the details of counseling is sometimes far from our basic knowledge. It requires you to be prepared. I'm not saying to memorize counseling, nobody can, but I'm saying to be able to extract the information from the reference in front of you based on the structure given to you by EDGE. And a monitoring plan is a must. Just remember, whether it's a prescription filling or an over-the-counter case. Okay? Do not miss the monitoring and follow-up plan. Switching gears to now we covered the prescription filling, we covered the OTC. What about the doctor cases? We said that 20 to 30% of the stations could be healthcare professional related. Is the same info gathering apply here? Yes, with some variations, and we will make it so easy for you during the program. What to ask, what not to ask for the doctor, and there are things which we're saying, you see here between bracket, to do it quicker, because we want to save time for other things that we do in more detail for the info gathering. So things that we do quicker and things that we do in more detail. For example, kidney, liver functions, relevant lab work, culture and sensitivity. These are few of many adds-on that we ask it only in the healthcare professional stations. In the patient station, if I want to give you something about kidney and liver, it will be written for you on the profile. It's not a common question to ask a patient coming to the pharmacy if you have your creatinine clearance ready. Who knows it? It should be with the doctor, and he should communicate it to you, or she should communicate it with you. So there are some questions that we ask only the healthcare professionals, and we ask it in details. However, there are other questions that we do it in a quicker way. For example, for the allergy question, which we're going to learn later, when a patient tells us that I have allergy, he tells I have allergy to sulfur, I don't take it for granted, because he might be mixing up between true allergy of sulfur and side effects of sulfur. So I have to ask what? Follow-up question. What symptoms have you experienced when you took sulfur before? And if my answer was, I got stomach upset, I got some rash on the palm of my hand, this is not a true allergy. We will have to dig deeper to make sure that this is maybe intolerance, these are side effects, but is not categorized as true allergy. What about doctor? When he tells us this patient has allergy to sulfur, would I examine him? Would I double check on him? For sure not. The doctor said it's an allergy to sulfur. My follow-up question, would you consider it type 1 true allergy or not? That's the max. Would it be anaphylactic shock or not? But I will not double check. I will not doubt that maybe the doctor is mixing up between allergy and intolerance. That would be a very bad peer-to-peer collaboration. We are hitting here in a very important part, peer-to-peer collaboration. Other stuff we will mention. I don't want to go into too much so that it's not so boring. I hope you are paying attention. Yeah, I know it's just a basic overview. We will go with all that in details when we start our program. But yes, there are some differences between the healthcare professional cases and the doctor and the patient-related cases. Reference checking here, even the references presented in the healthcare professional cases are little different than, or actually they are different, not little. They are totally different than the references presented into the OTC and the prescription filling. I just want to add one thing new. It's not now new. It has been now maybe for a couple of years now, that some stations you will not get any reference, nothing. You will get nothing. So in our program also, we will have to be ready, and we do multiple cases without references. So it's not all the stations will be reference-based. You might have 1 or 2 stations without references, and we will discuss in details. But for healthcare professional cases, you will find therapeutic choice on the top, pharmacovigilance, external reference like the JAMA, like the New England Journal of Medicine, any kind of publication, clinical trial. You can imagine totally different set of references than in the patient and OTC cases. In the patient-related cases, which is the prescription filling, you will find the CPS, number 1, on top of it, monographs of the medication, pharmacovigilance, you might have it, minor element for OTC. So even the format of references might differ from one station to another. And we need to get practicing on all. We need to get used, and we need to be mastering the reference checking across the different formats. It's not only reference books. Sometimes it's external. They are external references that has no layout. And we need to be quick reader, quick skimmer, so that we can make it in 2 minutes. Info providing in doctor cases are totally different. We do not go through the 8 points of counseling. The doctor doesn't need. You can do that with the patient. The doctor needs your thought process as per our 𝒐𝒐 standards. He needs to understand that you master the therapeutic area. He needs to know that you are aware of all the therapeutic options available for this condition. and then you narrow it down by excluding the irrelevant options with justification. And then you go to the third level of shortlisting, and then finally giving the autonomy to the doctor and making a recommendation. This is totally different approach, correct? We don't do that with the with patient dispensing a prescription or with an OTC recommendation. Totally different. So we cannot, OSCE does not have one fit all approach. We have multiple skills, and we have to adapt our skills to the nature of the case so that we look genuine, we look professional. Remember, we have to present ourselves. We are going to an interview. This is not what, again, keep saying, it's not only what I say, it's how I say it. I need to impress. So the approach, the skills, the depth of knowledge you show are as important as you say it right or wrong. This is the outcome. Always remember, outcome is not enough. And in our programs, specifically EDGE programs, we pay very, very high attention to the other two dimensions, communication and overall performance. Two critical dimensions in your assessment. Just to wrap up, our team is the word that comes to you when you see this, diversity. I'm too much into diversity, like different backgrounds, different ethnic groups, different races, genders. We have the only thing that is common in all these are licensed professional people who run all the programs for EDGE. This is what I can assure you. So, but we have people from Asia, Africa. We are so diverse. And most of them, and the good thing that most of them, actually, I would say all of them were my students. So they were before with us in the MCQ or OSCE, and they got licensed, and now they are part of the board exam, part of the faculty member of EDGE. So I'm so proud of them because they were just students maybe a few years ago, and now they are leading people to succeed. So this is something that we are really privileged and feeling blessed with them. Just details that we are having on site and we are having online. This is only for OSCE. For MCQ and evaluating, all our courses are online. So you don't have to worry about you are sitting in Ghana, sitting in Nigeria, in Algeria, no problem. You're going to get the same live classes, the same time, not only recorded. We have for evaluating an MCQ, we have both options. Live classes to ask an instructor and to be in contact with a live instructor, plus the recording so that you can review. For OSCE, we have on-site, meaning if you would like to come in person, you are welcome. We have multiple locations, and you can do it online as well if the distance does not allow. Okay. Like things just to know that thankfully with all the hard work, we have been highly recognized in Canada and outside, despite that we are one of the most recent, or one of the, I would say, the youngest company in the market. We have not been here. We have been also only here for 9 years. And so we're so happy. So we are so proud and so blessed that during this short time, we were able to get spotted domestically, locally, and also internationally. So we have many awards and many recognitions. You can find all of them on the website and on our social media, even the parliament. So thankfully, I'm not going into this. I'm not just trying to show off, but this is facts. And thankfully, the success rates that we achieved was the main reason for this kind of recognition. I will show you 2 slides before we go to the OSCE role plays. 2 slides. I'm not showing this just to make you feel discouraged or something. I just want to tell you that we have to take it serious. Do you see this circle around? There are four highlighted numbers, percentages, correct? MCQ and OSCE. international first-time test takers, which is all of us, international pharmacy graduate, which are not Canadian graduate. Anybody is not Canadian graduate is called IPG. The percentage of success in the MCQ for the first takers is only 41%. Less than a half, guys, for the MCQ. And guess what? For the OSCE is not big different. It's still 47%. Half of the people, actually more than half of the students who get into the OSCE or MCQ as an IPG first timer, they don't make it. What about the repeated second timers, third timers? The percentage little bit better, but still in the range of 50 to 56%. So what is the benchmark? Where is the benchmark? The reference. Our reference are the Canadian graduates, and you can see this. The gap is so big. It's almost double the success rate of the reference benchmark. Canadian graduates is almost double that of the IPG on both the MCQ and the OSCE. And just a note, even for evaluating, but they didn't get the statistics as clear as that. But evaluating, I can tell you, I have similar statistics or even worse. So we have to take it serious from step one, from the evaluating exam, to pass from the first attempt, because failing the exam, you can tell the consequences. A lot of money paid. Even the exam itself, preparation courses, fees. In some provinces, they require you to take a program in the university. And by the way, the fees is close to 17,000. So we don't need, I hope all of us can avoid repeating a test. I hope. There is no 100% success, but yes, our EDGE success rate, thankfully, and this is an average for the past 2 years, and you'll find these numbers are changing every year. So I'm still waiting for the results of November exams, because these numbers will change, and I hope it will change even higher. So remember the 91%, which is the best benchmark for the Canadian graduates. Thankfully, EDGE students beat it. 95% for the OSCE and 93.7% for the MCQ and evaluating. And thankfully, this is one of the highest. I cannot say the highest because I don't have the statistics of all the other companies, but I can say this is one of the highest, and I'm so proud of it. So proud of you, because you did this, and I want it always to be higher and higher. I'm waiting for November exams, and hopefully these numbers, I will show it to you by the beginning of the year. It will be higher than that. I'm positive. To wrap up, we are different. In class online, you can find everything you want here. Study library and question bank for EE and MCQ and OSCE are always updated. Every single cycle, we have something new added on the library. Our group setup, we do not crunch 25, 30 people, never. My commitment to you, small groups to get the maximum value, whether it's an evaluating or MCQ or OSCE, does not matter. You will have very focused small group setup. We divide the groups into multiple groups. That's why in some courses we work 7 days a week, because to accommodate the number of students. We do one-on-one coaching. This is something that you will not find, but EDGE Plus, one-on-one from a company, from a company, not from just somebody who, like just having a part-time job. We have group coaching, small group coaching, plus if you need, we have one-on-one coaching across the courses. We don't only do the education and academic part, we do also immigration. So we have a sister company that run all the immigration files for our international pharmacy and medical graduates. And also we do career placement. After you finish and you want to work, we have a huge network of pharmacies if you got stuck in that. Last, we have installment payment option. We try to, as much as we can help for the international graduates who, in the beginning, they are a little bit still building up their career. All of us, no embarrassment, nothing, never feel different. All of us, including myself, before getting licensed, we were all needing this support. I cannot just have a couple of thousands upfront payment. No, nobody. So we try to be very, very accommodative to that, and accommodating your needs and your financial plans as well. And finally, our success rate speaks for itself. I will stop here. I hope I wasn't boring. I hope you are still alive. I know that we are very small, even here, we're very small. Some people just send me notes that they want the recording. So that's why thank you for that. We have this recorded, and we can send it to everyone after this. Anybody, before we start, before we will do a role play, but anybody have a question? Anybody, anybody? I know is Wonder and Warda. Anybody? Anything is not clear?
So this is Wonder. So I must say, I must say I'm really impressed with the delivery. So I'm a practicing pharmacist in Ghana, and I've been wanting to write, the PEBC, but I must say I'm lost as to, who is going to help me out. So having to come across, your company, and having to impress me with the delivery, I'm very confident, that I'll be able to be giving, the best, service when I apply. I'll be looking forward. I'll not be applying now. Definitely next year, I'll be applying, and I hope to receive the best of all, what you've taught me, and to be able to pass the PEBC. And I'm also grateful that you've also indicated that, you also do immigration process, for immigration assistance, for international, pharmacists as well. So that also, helps, my course in that regard. So I'm very grateful. I'll be looking forward to your assistants contacting me. Then we can, we can forward the conversation from here. Thank you very much.
Brilliant, Wonder. One thing for Wonder and for anyone also, I always say it, even if if you are not going to start your process right away, start studying right away. Do not waste time. What do I mean by that? You can start from our self-study of evaluation, because we have an evaluating drive, evaluating an MCQ study drive. You can start from the evaluating study drive on your own pace, studying on your own pace, until you are ready, until you are ready to start the program itself. Then you hit the road, but you are hitting the road ready. You are not hitting the road starting a program and you have no clue about what we're going to talk about. You understand, Wonder and everyone? So that's why we give access to our study drives early in advance for evaluating and for MCQ, so that you can start reviewing. Maybe OSCE requires that you have from day one, this kind of guided coaching, and we build it together. But for evaluating an MCQ, you can start on your own until you get hooked up with one of the coaching groups, So just put this on the side. Some people just wait doing nothing until the document evaluation process is done. This can take 3 to 4 months. Do not wait, do nothing in 3 to 4 months. Make use of your time. Just a piece of advice that helped many people to succeed from the first attempt. Okay. Any other question? Any other question? Warda, are you okay?
Yes, I'm okay.
Okay.
I'm not good in English, but I'm working in this. I just want to tell you that I trust you. I am so excited to win, like you say, win or win. So I'm ready to start with you.
Amazing. I'm happy. Warda, do not feel at all, as I told you, maybe one time we talked, do not feel about your English that it's something that can hinder you. No. And Baher can also share, because Baher was an OSCE student before being our program head, correct, Baher? So she can share about Beher is from Iran, from, again, non-English speaking country. And she get herself to a very high level with speaking English, with communication, correct? So never feel that you are different than your students, other students. No, you are good. We are going to improve more. That's it. Okay. So feel confident. I'm just talking to Warda, to Wonder, to anybody who is not native English speaker, including myself. I'm not native English speaker, but we try, we practice, we talk. Even during with our friends, you speak in English, do not speak in Arabic, correct? Just try to be always practicing your language. And one last thing, if you need to have English classes, take it from the beginning. Improve your English language. You don't have to take even classes, paid classes. You can go to, newcomer centers. If you are in Canada, there are many newcomer centers that you can go there telling them, guys, I'm going to get enrolled in one of your English speaking classes. They will do it for you for free if you are a newcomer to Canada. Okay. So that's just an update for everyone, not only for Warda, but for everyone.
Thank you.
Brilliant. Okay. So let us do the following. Let us take a minute break, just 1 minute, and then we will continue role play. We will do like one case. I will do it as a demo, and another case we will do it with Baher as a role play. Okay. And you watch and you tell us, what do you think? What do you see? So let us take 1 minute first, just like a stretch or a washroom break, and then we come back. But don't go away. We need you here until we continue our session together. Okay. I would like to start with introducing for you one of our really one of the best success stories. I would really that she says about her success story, not me, with our OSCE program, because she was just a student like a few months ago, and now with her determination, hard work, smartness, a lot actually, and after maybe not a very successful attempts, I will let her tell you in like 2 minutes only to tell you the success story. She make it, and now she is one of the star program heads in our company. So I'm really proud, and I'm really thankful to all her contributions, and I'm hoping that you would be also similar to her case. So Baher, welcome Baher. I will let you introduce.
Thank you.
Yourself. Yeah.
Thank you, Dr. 𝐒𝐿. Hi, guys. I hope you're doing well. Everything's going well with you and with your studying. I'm Bahar. I've recently passed the OSCE, and I'm so happy that I have a chance to share my experience, especially my OSCE experience with you guys. Before getting to know 𝒔+, I took multiple courses, OSCE courses, and all of them very well known in the market. And one of them, we were about 15 to 16 students in one group, and they didn't have time to give every student the personal feedback. The other course just did the previous exams cases, and I thought that it didn't work at all for me. And also some courses, in some courses you have to practice some easy cases, and we all know that the real exam is not that easy. And fortunately I got the chance to took the course with 𝒔+. Dr. 𝐒𝐿 helped me a lot because we practice different kinds of, as he mentioned earlier, we practice a wide variety of cases. And also the thing is, as you know, and as Dr. 𝐒𝐿 mentioned earlier, outcome. It's not just OSCE exam. It's not just about the outcome and communication and performance. I think that not more important, but are important as well. And Dr. 𝐒𝐄 helped me a lot to first to know my weakness, and then he helped me to work on my weakness and boost my communication, boost my performance. And at the end, I was very confident. And the other thing that I really liked about the course is that the cases are not easy, a little bit hard, but at first, maybe at first it's hard. But when I went to the exam, all the exam cases were super easy for me. And because I was over prepared with this course, and I really appreciate Dr. 𝐒𝐄 and 𝐻+ team. And I hope you guys have the same experience, and I wish you all the best.
Thank you, Baher. Thank you, Baher. By the way, Baher is, like she's saying everything sincerely. She shared the experience as it is. No cosmetics, no ads on. This is exactly what happened. Okay, you can go, guys, also to I will share with you our social media links. We have LinkedIn, we have Facebook, we have Instagram. We have like hundreds of students like Baher who are sharing, and maybe you have heard in the beginning, we just put 2 or 3 of them in the beginning of the session. So again, what is the purpose? Not the purpose is to show off or anything. The purpose is to tell you that it's doable. Because some people has a very negative experience on the PEBC exams, especially OSCE. They said, oh, it's impossible. We have to do it from the 3rd attempt, from the 2nd attempt. No, you can finish it up. You can do it from the 1st attempt. I can assure you that if we work together, hand in hand, you listen carefully. I'm not very democratic, I know, in terms of giving the guidance. Just take it as is. It's not a matter of arguments. You can argue after you succeed, Now Baher is arguing a lot when we discuss MCQ topics or EE, yes. But during the OSCE, we need to follow the success recipe. Why should we reinvent the wheel? I have already the guidance, the success guide. So I'm just telling you too that it is doable. Just put your passion, motivation, persistence, and we can do it together, okay? MCQ or OSCE or evaluating, 1st attempt, no more. It does not require more than 1 time. Save your money, save your time, okay? Thank you, Baher, for sharing. I will do first. So sorry, Baher, can you take care of, by the way, I think Warda, we have her email. You don't have to get Warda's email. But for Warden, for Wonder, take all the information, Baher, and we can take it offline, okay, for Wonder. Okay? Let us do something very interesting, and I'm recording that, even that it will be also helpful for, I have many messages that people were not able because they have some other commitments that they want. So whether it's recorded or live, you get the same value. Let me do you a little demo about an OSCE station, and then we do a last OSCE station as a role play with Baher, okay? So let us take the osteomyelitis, and I hope that maybe that about osteomyelitis therapeutic area. People who are in MCQ, even in evaluating, you will need to start studying. That's why I'm telling people in evaluating, start early, because when you are prepared from the evaluating step, it will be super easy for you when you reach the MCQ and the OSCE. Okay. So let me share with you again the screen. And let us do a kind of a demo together. It's not like something that it's a role play. We will do the second one with Baher. Okay. So can you see the screen? Everything is clear. The door note is telling you the instruction on the door that you remember they said the door note, that the one that you will be in front of the door reading the instructions so that you can apply what they ask you to do. So here the door note is telling you that there is a doctor waiting for you. So number one, this is a healthcare professional based case. And we said that 20 to 30% of the interactive stations would be one of the HCP cases, okay? Is waiting for your professional judgment on an antibiotic choice. Keyword, remember when we said we have to be so careful. If they give you such a keyword, and it doesn't happen in all stations, disclaimer guys, not all stations you will have such an obvious keyword, but believe it or not, if you do not pay attention, you will miss the obvious one like this. Why I'm saying that? Because as long as the door note is telling you the doctor is waiting for your recommendation for an antibiotic, then you are in the section of anti-infectives. So you will get your brain ready, kick-started, you know, like jump-started from the beginning. You know, when your car is parking in your garage for a week and the battery started to get fading? No, I need to recharge the battery so that my brain battery start to wake up and to say, what do we ask in the anti-infective world? I should never forget about culture and sensitivity. Should I ask about last antibiotic use in the last 3 months? Should I? You will start to have the questions flowing, the ideas flowing so smoothly, as long as I utilize the 2 minutes before entering the station. Although I don't know, they will not tell you the therapeutic area is acute osteomyelitis. It will not be as clear as that. But even if I know that is an anti-infective world, I will start retrieving my brain / battery, making it ready so that I can hold an interview with the doctor on this therapeutic area. Okay. The reference is, I think Baher already sent the reference. I want you guys to try. I know it's in the beginning, it might look difficult, but try. Baher sent it on the chat box, correct? Just,
I did.
Yeah, have it with you guys, have it with you, and try to find the answer from the reference before I share you the answer, okay? Long story, there is a patient profile. You enter the station, you find this patient profile, the information of the patient. The name is John Wilson. The age is 6 years old. This is pediatric. Believe it or not, under stress, sometimes we see or hear 60 instead of 6. Can you imagine? And I don't want to share, maybe Baher would share something about that later on. Yes, I saw it a lot. So we have to pay attention. The age is 6 years. And if it's not written, I have to make sure that I heard it. Is it 6 or 16 or 60? You know, to this level of basic, you know, this is a basic mistake, but basic mistake that can potentially harm a patient. Okay. Allergies, he just mentioned penicillin and sulfa. That's it. No prescriptions because this is 6 years old. He doesn't take any, there is no medication history. There is no medical history. Vaccination, the box for vaccination is left blank, no information. Okay. For sure, that what was the case about? The doctor is coming for your recommendation for two questions. He wants your recommendation to help him in solving 2 issues. What is the antibiotic choice for the above patient profile for acute osteomyelitis? And the second question, which will be given to you at the 5-minute buzzer, remember, 5-minute buzzer, he told you, by the way, after you give me the recommendation for the antibiotic, when should I switch? What is the criteria of switching from parenteral to oral therapy? So guys, hint these questions, and you will be requested after we finish our discussion in few minutes to find the answer for me. Find the answer for me from the reference submitted to you. But before we do that, from your even knowledge back home, what would be missing information you need to ask the doctor before checking the reference? Be careful. You have 2 minutes, remember, to interview the doctor and get the full picture. Anybody has any guess? What would be other questions you want to ask the doctor? Would you like to give it a guess? It's fun, guys, if you try. if you try, you know. Any guess? There is no wrong answer, by the way. You can say anything. What would you ask the doctor? You see this allergies, for example, it's written for you penicillin and sulfa. Would you like to ask something here? Or something, we mentioned it in the intro. Anything?
Reaction or anaphylactic shocks?
You remember, very good word, the excellent. We will not ask the doctor what were the symptoms or reaction. Remember, because this is a doctor, we will just confirm whether this is a type 1 true allergy or not. That's it. Correct? That's the only thing. Brilliant. Excellent. Very good. What else you would like to ask the doctor, you think? Because it's not given to you.
We can ask the doctor the duration of parenteral treatment.
Okay, but this is what he wants you to give him. He wants you to give him the protocol, what antibiotic you would choose, and what is the duration. This is you will let the doctor know, not he will tell you. But I'm talking about from the information here, is there something maybe you need to clarify more? Something?
Le poids, comment on dit ça?
Okay, you turned to French. Okay, I will try to.
I can't. How is?
Okay, the vaccination. Okay, no problem. Vaccine. You want to say something about vaccination? Maybe no, nothing.
No.
Okay.
I will tell you this in English.
In English. Okay, go to Google Translate and let us know. And
yeah, hello. So this is Wanda. I will want to ask the doctor about the nature of the condition. If that is okay. Yeah, the nature.
Yes, absolutely. Osteomyelitis. If there are, when you open the reference, if there are multiple categories, I want to know whether it's acute or not, whether it is the nature of it, whether it's what is written in the reference, because you have two type of osteo. What is it? Can you read it? You find the ref? Did you
do you want me to share the do you want me to share it?
Yes, share
Okay.
please, and I will unshare, because this will be very important to know what questions are still missing. There are multiple questions. When Beher will show it to you, you will see that there are multiple questions. You see this, guys? Source. You see this?
Source. Hematogenous.
Hematogenous, or what is the other type?
Contiguous.
Spread from contagious sites, correct? Or hematogenous. Because when you start classifying from the beginning, where do I follow? It will make your even skimming of the reference in a professional, in an efficient way. Because if, for example, it's hematogenous in nature, and you are scrolling down into the other source, you are looking in the wrong spot. You are looking into the wrong recommendation, the wrong guidelines. You got my point, guys? So the very important question, which I think Wonder was wanting, and maybe Warda as well, was trying to say, what is the source of this infection? Correct? This is number one. Another question, which was not given to you, if you notice on the slide, the vaccination status. It's telling you unknown. Why? Because if you come here and the Beher is showing to you, the antibiotic choice is based on whether the kid is immunized against H influenza or not. Did you notice that, guys? So if my answer, he or she are immunized, I will look in a different section of the reference than if he or she was not immunized. Are you following, guys? So these are the questions that I need. And then for sure, any anti-infective case, we have to ask about the culture and sensitivity. This is by default, which we will learn during the program. Any anti-infective case, did you run any culture and sensitivity, doctor? Yes or no, or you want empirical treatment like this case? So this case, the doctor did not run CNS, did not run. He wants empirical treatment for pediatric 6 years old who has acute osteomyelitis, hematogenous in nature, and the vaccination status is unknown. So he wants you to give him the two options: when he is vaccinated and, sorry, if he is vaccinated and if he is not vaccinated. So we'll have to give two recommendations to this doctor. Making sense, guys? I don't get overwhelmed. This will be super easy for you when you get into the program and you get into to ask the right question and to interview the doctor in a professional way. You will find that it's becoming so seamless, so smooth interview. Okay. So based on these answers, I will, if I can, I will just switch for a second to the slide, and then I will switch back to Baher. So based on that, you will go back to the slide, our slide, and you will find that the questions that we need to ask, which I mentioned already, is allergy, the reactions and symptoms, because we asked him true allergy or not, and he said yes, it's accompanied by hives and rash. Source of infection, we did. Very, very important, the kidney and liver function in any healthcare, even if he's a 6 years old. We have to ask about kidney and liver function, plus the lab work, which we said the culture and sensitivity on the top of it. And if I am, for example, having compromised renal function, I have to ask about creatinine clearance, serum creatinine, and so on. Pediatric, 6 years old, it's not enough. I need to, as long as pediatric, I have to ask about the weight. Because if you notice in the reference, the dose is weight-based, not age-based. So not only age-based, he will give you the classification on the weight. So if you don't ask about the weight, you cannot make the calculation multiply by the milligram as per the reference. And finally, as we said,
It's weight.
Excuse me?
It's weight. I wanna say it last time.
Oh, okay. Oh, Google Translate is taking that long. Okay, maybe you have to choose. AI, Gemini AI or ChatGPT. It will be easy, quicker. Okay. No, I'm just joking. Yeah, for sure, the weight, and this is what Warda maybe was. Yeah, Warda was struggling in the weight. Why? Because you cannot make. And by the way, this happened in the MCQ cases as well. You will find very, very much overlap between MCQ therapeutic cases and between OSCE doctor cases. And this what Baher will help you a lot in reading the case in a very detailed way to reach out to the answer in a very confident and timely manner, because you can stay for 10 minutes until you find the answer. We need to be quick. You remember, the time is your first enemy. We need to make the time our best friend with practice and with proper coaching. Okay. Based on all that, as I said, we need empirical. Based on all that, we will have the answer easily outlined from the reference, which Baher just showed you. The whole answer of the case is present into a section in the table that we was highlighting. The whole answer, the antibiotic of choice in case of vaccinated versus unvaccinated. Number 2, calculating the dose based on the weight and the duration. Number 3, which is the last question of the doctor, when can I change or switch from parenteral to oral? And this is based on being systemically stable, temperature is normal, local signs of inflammation and tenderness are under control. Make sense? How do you feel about your first OSCE case? Are you still alive? Okay.
Yes.
Okay, good. At least where is Wonder? Wonder, are you still breathing? Just let us know.
Yes. I'm a bit lost, but I sure hope I'll definitely be able to get it. I work in a hospital, where we do similar cases. So, I strongly believe that, I'll be able to overcome, when I learned more. Thank you so much.
No problem. By the way, when you are lost, let me know. I know that we are not in the program now, but do not shy to ask, because we are still learning for sure. We're doing this demo, but when we start the program, we will have the list of questions you need to ask. It will be memorized by you. You know what to ask, when to ask, all this is coming by practice, but I wanted to just highlight the outline. Okay, you're not going to the exam next week, correct? So don't feel overwhelmed. And if you feel lost, let me repeat it again. This is what we do in the classes. We never let you go without being 120% mastering it, not 100%. Okay. Evaluating MCQ or OSCE does not matter. This is our commitment. And if it's taking too long for any reason, we will have a offline, we'll tell you, okay, go and study this and this and this, and then we can have a discussion later on, so that we do not interrupt the rest of the group as well. Okay, this is how we do the tutoring in our classes. Perfect. Okay, what about doing one role play case? Role play meaning Baher will be acting as the pharmacist and I will be acting as the patient, coming to fill a prescription for PEGVIT. Okay, PEGVIT, you guys, this is a prenatal vitamins. Okay, guys, maybe it's not in the same name in our countries, but it is present here. It's very well known that any pregnant woman take it before pregnancy, during pregnancy, and up to 2 months after pregnancy. Are you aware of it by any chance? No? Okay. All right. So Baher, and now I will share the screen for the door note. This would be a role play. Role play, it will be 7 minutes, timed 7 minutes. And Baher will interview me. So all what we did now will be in application, and then we take it from there. Okay. So let me share the door note, and then we will finish, we'll wrap up and finish after that. Okay. If you have any questions. All right. This is the door note. Can you see it? The door note is telling you Monica Miller is giving you the name of the patient. Brilliant. Is a customer coming to... Sorry? You cannot see it? Yeah.
No.
All right. Sorry. So I will refresh it. I'm sorry. I will refresh it again. Thank you, Baher, for letting me know. So Monica Miller, I will refresh it again. Can you see it now? Can you see it? Yeah.
It's downloading.
Oh, okay. It will take...
Oh, yes.
Okay. So Monica Miller is the name of the patient, is a customer coming to fill a new prescription. Be careful. She's a customer at your pharmacy. This is a key word. She has all the information locked in your pharmacy. So you will only update it, not ask from the start. But she's coming to fill a new prescription. The word new is a key word, which means that we have to ask to check all the appropriateness of a new prescription, as you do in practice. And then the CPS, which Baher has uploaded, is your only reference in this case. Very standard classic case where you need to do counseling and spotting the DTP if required. DTP, for sure, this is a big topic. You will learn it in the MCQ and you will learn it in the OSCE, drug therapy problem, okay? Or drug-related therapy problem. Okay, so we will start the 7 minutes. Once you hear, I will put the buzzer in front of you guys so that you know. This is the buzzer. Once you hear the buzzer, Baher will start, and I will share the profile of the patient. And this is the profile and prescription, correct? This is what you will have in front of you when you go to the real exam, when you come to us in the real mock exam. The profile with all the information of the patient and the prescription that the patient is coming to fill it from your pharmacy. Okay. Once you hear the buzzer, Baher, you can start. Okay.
Okay.
Hi, good morning.
Hi, Baher, the pharmacist. How can I help you today?
Hi, Baher. This is Monica here to fill my prescription, please.
Sure, I will definitely help you out. Please have a seat in our private counseling area. Monica, do you mind if I ask you a few questions to help you better?
Sure.
Okay. May I get your age, please?
I'm 42 years old and I'm Monica Miller.
Okay. And okay. And could you please tell me what made you see your doctor?
Yes, you know what? I have been now with my hubby thinking of this big project for a while until we take a decision to start a new family. So now I stopped taking my birth control and we are starting our conceiving attempts since a week almost. And I went to the doctor to
Okay.
get some vitamins. Yes.
Okay. Congratulations. You must be so excited, right?
So yes, it's my first
Okay.
baby.
And
Yes.
okay. And did your doctor tell you anything about this medication?
He said it's a multivitamins that I need to take, and it's something that will help me with my, healthy baby and so on.
Okay, I see. And do you have any medical conditions?
Oh,
Let
yes.
me check your profile. Let me check your, I have your profile. Let me check your profile, please. I can see that you're taking metformin 500 milligram
Yes.
and take 2 tablets 3 times daily
Yes.
to control your blood sugar.
Correct. I have diabetes, yes, type 2, and it's controlled with the metformin.
Okay, and is your condition well controlled?
Correct.
Okay, sounds good. And you're taking Synthroid 88 microgram. Take 1 tablet every morning. And do you take it for your low thyroid level?
Exactly.
Okay. And is it under control?
Yes, it is with this medication. However, I didn't do my lab work since more than 6 months, but at that time it was
Okay.
very good. Yeah.
Okay, I got it. And how about Alice? You stopped taking Alice, right?
Last week, yes, and we are starting our attempts since then.
Okay, okay, I got it. And any other prescription medication? How about any over-the-counter medication, herbal supplements, or vitamins?
I take nothing.
Okay, and it is your first baby, right? I just wondering if you have any personal or family history of neurological symptoms,
Yes.
disorders.
Oh, yes, yes. I forgot to tell the doctor. Thank you for reminding me. I have a first degree family member who has seizures and a lot of nerve issues and other stuff. I hope this does not affect my pregnancy.
Okay, I got it. Thank you for sharing it with me. And regarding you, and by any chance, are you breastfeeding by any chance?
No, this is my first baby. No.
Okay, and do you smoke at all?
One cigarette with one glass of wine. That's it.
Okay, and how about the exercise?
Oh, yes, I walk every day. Yes,
Okay,
30 minutes.
sounds good. Just keep it up. And how's your diet?
Very well balanced.
Okay, sounds good. And is your vaccination up to date?
Yes, it is. They are.
Okay, thank you. Okay, thank you so much. Please give me some moments and I'll be right back to you, okay?
Thank you.
Thank you, Monica, for your patience. Monica, first of all, uh, I'm a little bit concerned because I want to let you know that since you have a family history of, since you are diabetes and you have a family history of some neurological disorders, some nerve issues, I mean, and also seizures, you need to start taking Pregwit with folic acid 5 milligram. But the doctor prescribed Pregwit with folic acid 1 milligram for you. Got it?
Oh, okay. What should I do now? Yeah, I forgot to tell you.
I'm gonna
Yes.
I'm gonna let your doctor know about this, and I'm gonna counsel fully on this medication. And after confirming from your doctor, we're gonna deliver it to your place. Okay? Okay, sounds good. So you're gonna take a PEBC 5 milligram. It's a multivitamin supplement, and it should be started 2 to 3 months before your pregnancy, during your pregnancy, and also after your after your pregnancy, as far as your breastfeeding. And also, it's super important. You're gonna take it. It's better to take it on an empty stomach. But it may cause some GI upset, constipation, nausea. If you have this side effect, you can take it with food. Make sense?
Yes.
Okay, but it's super important to know that since it contains iron, it should be taken with at least 4 hours between iron and levothyroxine, because this can reduce the absorption of levothyroxine as well.
Yes.
And yeah, makes sense?
Yes.
Right. But the other important thing that I would like to share with you is that you need to see your doctor, because you need to get your blood work done to check your thyroid level, and maybe you need to increase the thyroid dose, the thyroid tablet dose during pregnancy. And the other thing that I would like to share with you is that you need to after finishing the current birth control, you need to wait at least 1 hormone-free cycle and then try to get pregnant. Everything's clear for you?
Yes, excellent.
Okay, sounds good. I wanna share with you that please quit smoking, for it's really important for normal baby growth, and also reduce your alcohol intake, and then completely cut down if you can. And yes, and the other health is the other thing is good lifestyle. And any other questions?
No, thank you. Time is done. Sorry, maybe you didn't hear the buzzer. The time is done.
I didn't hear. I didn't.
That's okay. Excellent. But let us, very excellent. For sure, guys, we are not going to start from that level, because this is what she ends with. This is what she succeeded with. But she didn't start like that, correct? If I show you Bahir when she started, correct, Bahir? So we will hide the recordings, correct? Because we all start at a very basic. Don't feel at all discouraged or it's not doable. The pro level that you reach to does not come overnight. It comes by a lot of practice with yourself, with your groups, and with under our coaching programs as well. So let me quickly say, for sure, I will not repeat what Bahir said. You see how she interviewed the patient professionally, despite the fact that she took more than 2.5 minutes. She took 3+ minutes. And we, for sure, because again, we need to be very careful. That's why she didn't finish on time. This is the only little drop that the time management did not make her finish all on time. But apart from that, everything was mentioned. DTPs, by the way, I overloaded with DTP. This is not because to make it difficult. I want you to learn as many drug therapy problems as you can from one case, because in the real life, you will find maybe 1 DTP. Here you can see that I overloaded with 3. The one with stenthroid, I didn't do lab work since more than 3 months, and I started to be pregnant, so I need to do a new lab work. Number 2, that I didn't, Bear was brilliant in spotting the ALICE. I said that I stopped it last week, and I'm starting my conceiving attempts. This is totally wrong. I have to have at least 1 to 2, 3 hormone cycle. This is all MCQ. And you will see when Bear start doing this with the evaluating, even she will highlight the therapeutic knowledge, because honestly, you will never find this in the reference. You will not. The reference only gives you the guidance about PEBC, how many times it's taken, whether you should space it with the other multivitamins, take it with food or without food. This is all the reference, but they will never give you a reference for the basic therapeutic knowledge that she said it all from her MCQ, because she was an MCQ student. So she knows exactly what she learned from MCQ, building on it with the OSCE skills. That makes the whole formula. Clear, guys? For sure, highlight, and we will learn about documentation and how to document to the doctor. I will counsel you fully. And she said the name and the medication and the strength and whether taken with or without food, and to space it from the other multivitamins, and to do and to quit smoking and alcohol. This was critical because this is potentially harming a pregnant woman. She said only one drink with one cigarette. We have to tell her that there is no safety. There is no safety limit. There is no guideline that tells a pregnant woman to take one cigarette and one drink. Show it to me. We have to really encourage her to abstain from smoking and to cut down alcohol until she stops it. So all this, you see how many things she picked on it. Not everything in the reference. So I take home message. Things are from the mind because she studied MCQ and evaluating so hard. And the rest was from the reference by skimming properly and getting to the main DTP that a pregnant woman can you just last thing, Baher, show the audience, show where is this, where she find the 𝒑𝒏𝒈. It is required for diabetic people and people who has any neurological issue in the family. Can you show them this? This would be the last thing.
Just
Will do my screen.
just give me. Great.
Yes, we can see it now, Yanko.
Diabetes.
Yes. Is that highlighted? Yeah, you are in the right. Yes, exactly.
Just give me.
But this is about the spacing, maybe. Yeah.
Just give me.
The previous
About
pregnancy.
what do you want? About the spacing or about the
The two things.
neural tube defects, diabetes?
Exactly. Number one is about the one that you highlighted now. Exactly, is the criteria for the 𝒑𝒏𝒈 usage. Did you see this, guys? 𝒑𝒏𝒈 is a prenatal high-dose folic acid, okay? Formulated for use in women who are planning pregnancy or who are pregnant who have, number one, previous pregnancy affected by neurotubal defect, NTDs, or have a family history of neurotubal defects, or have diabetes or malabsorption disorders like the IBS or IBD. Can you see? Or people who are taking for sure antagonists like methotrexate. These are the criteria that we choose. Pick 𝒑𝒏𝒈, not 𝒑𝒏𝒈1. The doctor just mentioned 𝒑𝒏𝒈1. We have to, this is our role as pharmacists. Our role as pharmacists is not to count pills. Our role as pharmacists is not only to get the cash on the cashier. Our role as a pharmacist is to be a peer-to-peer, to show utmost patient care, and to be a peer to the doctor, to tell him, doctor, I have an issue. We need to give to this patient 𝒑𝒏𝒈, not 𝒑𝒏𝒈1. This is a confident pharmacist who is ready to practice. This is the pass mark for us. You got it? So she's showing you from different parts on the reference. Do you think that Baher started like that, skimming the reference in less than a minute and a half? No, she started by taking 4 minutes at least to skim the reference, remember. And then she started to be 3 minutes, and then 2.5 minutes, and then 2 minutes. And some people, including herself, were skimming the reference sometimes in less than 2 minutes. Why? Not because she has a magic stick, because she got the proper coaching and she started her own self-practice. Without her own determination, she wouldn't have done it. Okay. Perfect. Any question in this case? Thank you so much, Beher. Any question in this case, guys? Any question? Anybody? Okay. All right. I'm happy that.
Hello. So this is Wanda. So my question is, so because I'm coming from a different jurisdiction, I'm coming from a different, area of practice. The PEBC, so we have folic acid generic. That's the name. I don't know PEBC is folic acid. Initially, I didn't know PEBC was folic acid. And then at least 28, Synthroid. I don't know any of these very brand medications. So how will I be able to understand, for me, exactly when I'll be writing my exams? I'll not be coming to Canada. I'll stay in Ghana here and write my exams. How will I be able to understand all these brands and be able to identify this, this as what they are talking of? I don't know if you understand my question.
I do. First of all, number one, they put the brand and generic. The reason I'm not putting here I put only the brand name, because for OSCE, because you said something also not very correct, Wonder. You can write all your exams while you are in Ghana except the OSCE. You have to be here. You cannot write it online. You cannot write your OSCE. You have to be here, and you have to do after it. You have to do the internship. You cannot do it online, correct? So we can help you to get all the exams done back home except the OSCE. Put this in consideration that you need to get here before doing the OSCE exam, and I always encourage, that's why I didn't put the generic name on purpose. I always encourage any student, including myself when I was a student, because I haven't worked in a pharmacy setup. I was working in pharmaceutical companies. I had no clue about brand name and generic name until I came here in Canada 3 months, when I started to do some practice 3 months before the OSCE exam. And I started to know them brand and generic. I'm not saying I memorized all of them. I'm saying to get acquainted. But don't worry, your answer to your question, they will be putting the brand and generic. But I always on purpose hide the generic to let you encourage to go to have this hands-on experience in real Canadian pharmacies. You cannot go to the exam, Wonder, without having some shifts in real pharmacies here. Not as a pharmacist, you will be working as an assistant. And you look at the dynamics, you look at the name of the, I encourage my students, even, this kind of OTC medication, like very, very regular OTC, even they look different than back home, correct? I encourage you to go to the big pharmacies, and I have here small pharmacy in our company, but I encourage you to go to big pharmacies and see the brand and generic, just to get acquainted, to let your eyes be landing smoothly on that. If this answers your question, but you have very valid point, yes, at least will be written for you the generic of it, which is the combined contraception, the combined estrogen progesterone. It will be right for you the active ingredient written, and for the Synthroid it will be written the levothyroxine, which is the active ingredient of Synthroid. And for PEBC, it's not a folic acid. PEBC is a multivitamins. You will find in the reference, it's a multiple vitamins, including vitamin B6, including vitamin B9, B12, including iron, including calcium, plus folic acid.
Sure. Thank you so much. You've answered my question. I'm very grateful.
Thank you. Perfect. Warda, are you still here?
Yes, I'm here.
Okay. All right. So are you still motivated, Wonder and Warda? I know that. Thank you so much. You are the only people who were coming live. To the other people, they just want to see the recording because they have other family commitments. Thank you for making the time. Thank you for attending. And we will start the journey together, whether you are on the EE status or on the MCQ or on the MCQ and OSCE. We are with you, and hopefully we will finish it up from the first attempt. No other attempts, please. All of us, you and us, want that. One attempt and done. And then we will enjoy having you with us, helping us in courses. We have multiple courses, so we need a lot of people to help. I wish you all the best, guys, and we will stay in contact. Baher, I thank you so much for helping in this seminar. And congratulations as well for your OSCE success, MCQ success. So Baher was a star in every course she was in, and now she's helping hundreds of students in the evaluating an MCQ to pass like she did. First attempt, nothing else. First attempt. Okay. All the best, guys. We'll see you soon, and take care, and see you very soon.
Thank you very much.
Thank you.
Thank you.
All the best.